What are the main treatment phases for acute lymphoblastic leukemia, and what's the goal of each?
ALL is a great example of a very classic cancer treatment pha- phasing. So, the first phase is what we call induction, the second phase is consolidation, and the third phase is maintenance. There are sometimes regimens that use different names for different components of these phases, but the first phase is probably the most intense with most regimens. The goal of that phase is to induce a remission. And what that means is we want to clear the body of all detectable cancer cells. It's very different from what we would call a cure. Remission is not considered the end of therapy. It just means that we clear of all detectable cancer, but with the understanding that there is more cancer that needs to be treated. But the goal really is to reduce the burden of the disease as low as we possibly can. There are some more nuanced goals that we're incorporating into that. It used to be that remission meant a very, very low number of leukemia cells that we see in the bone marrow. But now we have more sophisticated testing that looks for what we call submicroscopic disease. So, disease that we can't even see under the microscope using very sophisticated technologies that can detect minute populations of cancer cells down to one cancer cell out of a million cells that are evaluated. And we call those tests MRD or measurable residual disease. After an induction phase, patients generally go through another bone marrow biopsy. We look to see if there's disease under the microscope, and then we add on these additional tests to look for very small amounts of disease. And that has a lot of information that will then guide the next steps in treatment and also has prognostic significance for us. So after the induction phase, we move on to a form of consolidation. The goal of that phase is to consolidate that remission, to kind of deepen that remission, make sure that the remission is more stable. And after that, many regimens, though not all, have a maintenance phase. This maintenance phase is meant to prevent relapses. Most relapses occur in the early years after finishing those first two phases. And so the goal of maintenance is to deepen the remission, prolong the remission, and prevent future relapses.
So, in general, we divide the treatment of ALL or acute lymphoblastic leukemia into a few standard components. The first component across a range of different regimens is called induction. The purpose of induction therapy is to try and clear away the bulk of the disease and induce a complete remission, at least at the level of being able to look under the microscope and not be able to see any overt evidence of the leukemia. In general, the goal of induction therapy is to clear away the disease so that we're at a state where there's less than 5% leukemia under the microscope and where the person has some degree of blood count recovery, meaning healthy neutrophils or infection fighting cells and healthy platelets that help us to clot our blood. We generally have another block that is called consolidation that consists of multiple components, but the overall goal of consolidation therapy is to deepen the remission, eradicate any measurable residual disease that might be there. And this generally consists of a number of intensive blocks of treatment. The maintenance phase is just that, is dedicated to maintaining a deep remission that has already been achieved with therapy. All of these treatment components include central nervous system prophylaxis, including with intrathecal or intraspinal fluid delivery of chemotherapy. Importantly, depending on the specific aspects of their disease, a stem cell transplant, also known as allogeneic hematopoietic cell transplantation or bone marrow transplantation, may take the place of some of these components of therapy. And so, for example, someone may have a shorter period of consolidation if the plan is for them to proceed to an allogeneic stem cell transplant rather than to receive definitive chemotherapy.